the video is the one that was developed by our colleague from the Swiss Federation for Mine Action that is currently operating in Mindanao, Philippines. So it's a great context and facilitation whereby the risk education of both explosive ordnance and COVID-19 are done at the same time through innovation. Yeah. Yeah, thank you. Thank you, Paul Craig from FSD for sharing that video. It gives us more context as well, and I believe many other organizations also doing similar effort during this pandemic. So I think without further ado, we have some presentation from each affected member state. So I'll probably start with Cambodia, if I may, by inviting Mr. Dara Sen from CMAA, the Cambodian Mine Action and Victim Assistance Authority. He's currently the Deputy Director of Public Relations Department. Paul Seng, if I may invite you, please.
Thank you, Dwi. Do you hear me clearly?
Yeah, perfect. Thank you.
Thank you. So to start my presentation, I would like, as a Cambodian EORE focal point, and on behalf of the all EORE operators, I would like to express my sincere thanks to ARMAC and team once again for making this event possible. This is an opportunity for all ASEAN member states and experts from different organizations around the world to share innovative and alternative approaches in modifying the current ongoing of EORE in prevention of COVID-19 pandemic and outbreak in community. EORE program has been implemented in Cambodia since nearly 3 decades with the aim of encouraging people to behave safely and for the prevention of mine and EOW accident and injuries. EORE program presently coordinated by EORE unit of Cambodian Mine Action and Victim Assistance Authority, CMAA, and these programs are being implemented by both government and non-government institutions. Different approaches are being applied, including integrations of mine education, key messages in the primary and secondary curriculum, school curriculum, and textbook, and child-to-child mine risk education, and community liaisons and performance shows. So Cambodia EORE approaches have been adopted to reflect the evolutions of the natures of lead mine and ERW accident and country development. But now the world is facing outbreak of COVID-19 pandemic health crisis. It is impacting everyone around the world, and Cambodia is no exception. This is difficult time for us, especially to those who are vulnerable population. So the impact of COVID-19 in Cambodia EORE program, all the schools have been closed until further notice. As a result, EORE program through school curriculum, child-to-child mind risk education, and MOE session with group, big group have been suspended to ensure social and physical distancing. It is very important for all of us to continue doing our work in protecting, children and women and vulnerable populations with extra efforts and measures to ensure that they are safe and necessary services are provided to them. Therefore, the key messages and posters on COVID-19 preventions and hand washings that have been endorsed by Ministry of Health, WHO, and COVID-19 messages have been integrated as a part of EORE key messages, and posters have been also distributed to affected community by EORE operators. In response to the pandemic, CMA is actively cooperating with development partners and to fight against the pandemic of COVID-19. CMA has supported UNICEF to distribute 52 and 100,000 of COVID-19 posters on preventions and hand washings, and 5,200 pieces of soap for EORE operator so that they could use them while delivering EORE messages and posted them in the community. So that is what I have shared with you, the impact of COVID-19 in EORE program in Cambodia. Thank you.
Thank you, Bong Seng. I think we will probably go on with the next presentation, but we have Hal Judge coming back from Australia. He had a bit of problem on the technical matters, so I will.
Thanks, Dwi.
Hand over to you.
Thanks, Dwi. I fell off, but I'm back again. Okay, now it gives me pleasure to introduce Mr. Josh Ridley, the Program Officer from Halo Trust, to talk about what is happening from Halo's perspective in Cambodia. So you have the floor, Josh.
Thanks very much, Hal. Good afternoon, everybody, and thanks to ARMAC for organising this event. I'm pleased to say that for Halo in Cambodia, COVID has a very, very small impact on our overall activities. Our clearance teams work in 3 or 4 week cycles, and they had just deployed in March when the number of COVID cases started to increase a lot, and we were quite worried about the situation in Cambodia. We introduced all the usual safety measures such as social distancing, face masks, and hand washing, and we felt that our camps and our teams were already very isolated from communities, and that they're already in the safest place that they could possibly be, next to minefields where nobody goes. So clearance team wise, we weren't affected at all. We did withdraw our MRE teams very quickly because we recognized that there were potential vehicles of transmission around rural parts of Cambodia. We also wanted to avoid putting our staff at risk of catching the virus. We didn't want to be perceived as being reckless as well, or even if we weren't being vehicles of transmission, we'd still be perceived as being vehicles for transmission. And we could also quite easily retrain our EOR team members who have in some cases, decades of experience working in clearance teams or survey teams. So we felt that we could retrain them and redeploy them if the situation continued. But fortunately, in April, we had a long stand down and then redeployed as normal at the end of April, when it looked like the situation in Cambodia was stable and safe to redeploy. So our MRE teams have redeployed now. We are fully operational, albeit EOR teams are gathering much smaller groups of people, and they are practicing social distancing and enforcing that in sessions, and sticking to all the hygiene and health advice as well. In May, we had quite an interesting project in partnership with the Bobby Charlton Foundation to deliver MRE in rural parts of Battambang, but also distribute a lot of COVID materials or COVID prevention, materials such as soaps, face masks, bleach, and also distribute posters. We identified ID poor households, so that's the very poorest people in Cambodia, to distribute these materials to help them prevent or to mitigate the spread of the virus. And under the Cambodian Mine Action Authority, we also distributed several thousand posters in mine affected parts of Cambodia, all the time practicing social distancing and wearing protective equipment. Regarding whether the third question here, are there opportunities for integration between EOR and COVID-19 risk education? Yes, yeah, I think there are, and I think the COVID project that we delivered in May, it's just finished as of today actually, is a good example of combining EOR with other very important COVID activities. And guidance on the CIMA has been very helpful, and we're very grateful to all the donors who have provided information and funded this nationwide poster distribution campaign. And I guess for the second question, are there alternative approaches to deliver EOR which avoid the risk of spreading the pandemic? For us, not really. We wanted to withdraw our teams pretty early on because of the risks I mentioned before. Other channels that we could use, such as our Facebook channel, which has quite a large following in Cambodia, we're aware that we're not really reaching the right people with that. Internet access and usage of social media is quite low in rural mine-affected parts where we work and where the greatest risk is. So we didn't feel like that was a particularly useful channel to use. But more broadly, in a COVID sense, we did use our social media channels to deliver health messaging as well. So that's probably my 5 minutes up. Yeah, thanks.
Thank you very much, Josh. And Daraseng, it's really encouraging to see how you've responded so quickly and adapted. Congratulations for that. So we're now going to move to Lao PDR. And I understand that Mr. Chomyang was here earlier, and he had to leave and may have delegated to another representative from the Lao NRA. So I'd like to hand over to representatives from Lao, and also secondly to Mr. Julian Campaniers from the Regional Mine Action Specialist at Humanity and Inclusion. So let's go to Lao to see what the current situation is there.
Hello, good afternoon, everyone. As Mr. Chomyang mentioned earlier that he has very urgent meeting. So what we have agreed with Mr. Chomyang for presentation, he has prepared for this meeting. However, he will come back very soon. Is this possible? Lao PDR would like to suggest that we will be the last speaker of this. Is that okay? Can you hear me?
Certainly, that is fine. Yes. We'll come back to you when Mr. Chomyang is available. Thank you.
Yes,
so,
yes.
So we move to Julian.
Can you hear me? Yes? Hello, hello?
Yes, we hear you loud and clear, Julian.
Ah, okay, that is good.
Proceed. And we
Okay,
can see
so
your PowerPoint.
Let me thanks again, ARMAC, again for this great initiative. I will try to make my presentation fit in 5 minutes. So quickly, I will take the example of our current project in Laos, where we have a project that we call Comprehensive Approach to Mine Action, meaning that we are working in all the pillars of mine action. And in fact, also we are working on numerous other projects in the country. So it allows HI to have a good network of partners at all levels, and it's useful for the dissemination of information. So on this slide, you can see some pictures from the last 2 weeks of our teams. They are all back in the field now. So in Laos, luckily, there are not a lot of confirmed cases so far. The impact on our project are not so huge, but because the confinement was in April, and it was our campaign break, and it was also the new year here in Laos. So we were able to quickly resume our work for all activities that are not directly done in big groups. So survey, clearance could be resumed with specific SOPs. For victim assistance, we work directly with persons with disability, and this is also restarted. And for ERI, it's the main important issue, as our team are really working closely with the communities. We have a duty of care for our staff, but also for the beneficiaries. So all the safety briefing, movie events in communities, everything that is in a focus group really are on standby by now. And the training of teachers in the school also, because the schools are still closed. But we have decided to maintain the risk education through the visits in the household. So we can conduct safety briefing in each family. All this is done with appropriate PPE and protection measures. So you can switch to the next slide, please. So this is I would like to show you very quickly this framework. We call this the Be Safe project. It's the frame for the intervention on COVID in all affected countries in the world for HI. I will not go through it in detail, just to show you on the pillar 1 here in yellow, which highlight the contribution of our mine action project to this response. So actually, the objective is to contain the spread of the COVID by supporting the health response. And so the idea is to be able to be reactive enough and to redirect the mine action classical assets, ambulances, medical staff, awareness activities to support the government of Laos. And actually with our mine action project, we are able to cover all these activities. So you can go to the next slide. Yeah, I don't see the next slide. Yes. So alternative. So as an alternative method to let's say some old-fashioned mine risk education activities, I would like to explain what we've done in the past years here in Laos, as we try to set up some community-based risk management strategies in each of our villages. And the concept is to support the establishment of a network of volunteers for risk education to maintain the information about the UXO threat in the communities. And in addition, the communities are also asked to identify specific alternative solutions that could prevent the risk of accident in their village. So when those mechanisms are in place, it can be used to manage some other risk, like natural disasters, for example, floods, fire, landslides. It can be used for road safety, or in the present case, it can also be used for outbreaks. So concretely, it means that we can continue to disseminate the risk education messages, but also COVID prevention messages through this network, even if there is no access to the villages or if there is a lockdown in the country. And we can also define specific IEC strategies for each village to identify what could work, what could not work in each of the communities. On the next slide, so I listed some opportunities for the integration between risk education and COVID, but I would like also to highlight some threats to these opportunities, because I think there is responsibility also to do no harm. and we should also look at the potential negative effects. So behavior change and risk reduction are the main outcomes of risk education. So I think this is a good idea to rely on the risk education activities for this integration. So here you see we can use the hotline number and the liaison with the community focal point to facilitate access to emergency medical team and to allow safe transportation to the medical services. We can use the RE team because they are used to awareness and community liaison. They often master the local language. They know how to handle properly the IEC materials. But at the same time, we must ensure that they are properly trained on the COVID. It's a very evolving context and with a lack of information, so it's quite challenging. We can use innovative vector of dissemination. It's good to reach the remote place, but actually we might not forget also that some people won't have access to social network or other channel of communication. Then we can also have IEC material that can integrate both risk education, EU risk education messages and COVID prevention messages. But once again, we need to ensure it will not be too confusing for the target population, in particular for the kids, as the message and the objectives can be quite different. And then we have also observed donors and authorities that are positive at the moment and willing to support, but same, we need to also have close coordination and reporting and respect the regulations that are in place. So this is just open question, but I think it's also good to look at the bad potential effects that we can have in this integration. And on the last slide is some key ideas, sum up. So risk education can be implemented in a more comprehensive way, not only during the time of a crisis, but also to be used, yes, to be used as a tool for preparedness. Action should be coordinated and also linked to national COVID response plan and Ministry of Health strategies. And there is probably a space for ARMAC here, maybe to promote the contribution of mine action sector into this crisis and to organize a repository of the resources at the regional level, maybe in coordination with the risk education advisory group. Leave no one behind, obviously, because it may be difficult to get information or data from the most vulnerable people. And finally, to conclude, just to say that in front of COVID, we have to be smart. Intelligence is defined by our ability to adapt. So this is evolving situation. Nobody can anticipate this. And we don't know if it will last a long time or not. So a good project should be also able to evolve. And I think the donor and authorities will be supportive. Thank you. I hope I'm within the 5 minutes. Not sure.
Ah.
Hello?
Thank you.
Can you hear
Thank
me?
you, Julianne. Now we go back to Mr. Chom Yang, Director of NRA Lao PDR, I believe is ready to go. Over to you. You have the floor, Mr. Chom Yang.
Thank you very much. Sabai, you can say in Lao Sabai. Good afternoon. I would like to share some information regarding to the COVID response in Lao PDR. So first, I would like to introduce Lao PDR, one of the countries as impacted from COVID-19, and the Prime Minister issued the orders dated 29 March 2020. In order to prevent the COVID-19, the government locked down overall the countries. So the national regulatory authorities for mine action in Lao PDR also informed the operators, organizations concerned to note about Prime Minister's orders, and also suggested to working from homes as well as social distancing. Apart from that, the national regulatory authorities also coordinated closely with UNDP and Trade to buy the temperature testing kits for supplying to the officials and also the provincial offices. NRA has its annual work plan that for 2020 and implemented by quarter and weekly work plan. So the activities in the Q1 and Q2 implemented very few activities. We can implement only the administrative activities so that we affect a lot of activities during the COVID-19. So apart from that, UXO humanitarian teams also stopped their operations and allow their staff to stay home and also working from home. There are 5 operators in Lao PDR. There are 16 NTS team. There are there are about 53 TS team and also 140 clearance team that stopped their work. Probably our friends would be the same situation as Lao, that they infected very much from the COVID-19. So regarding to the risk education, UXO risk education in Lao PDR, we have 30 teams from the other operators, such as HI, UXO Lao, and also village volunteers that under the responsibilities of Lao Youth Union. And also SOS, we have radio programs broadcast in 5 provinces, Hello Trust, and also village volunteers, MAC, MMG. I'd like to emphasize that during the COVID-19, UXO risk education radio program integrated awareness on the COVID-19 to the UXO radio programs. It takes about 2 minutes talking about the COVID-19. During the 18th May, the government tried to open step by step because of analyzing from the national task force on the COVID-19. So the operators are communicated with the provincial task force on COVID-19, and some provinces allow them to work, but need to follow on the prevention of the COVID-19, such as jails, distancing, and also the temperature testing. For the future plan, that we also agreed among ourselves, and also I also provided some recommendations regarding to the integrations of the risk education to the regarding to integrate COVID-19 to the risk education teams in the from the operators. So they will coordinate with the health sector. So this is the some situation that occur, and also this is the some plan that we will implement in the near future. For the regional activities regarding to ARMAC responsibility, I think in the near future, we should have some kinds of comparative study or assessment or survey on the COVID-19. Probably we can learn each other's on the COVID-19 response, especially in the UXO and mine sector. So that I would like to share some information apart from Lao PDR. Thank you very much.
Thank you very much, Lao PDR. It's very encouraging to see how proactive the NRA and humanity and inclusion have been in responding to this emergency. So congratulations there. Moving quickly to Myanmar, where we have Mr. Win Nang Thun, Director General of Department of Rehabilitation, Ministry of Social Welfare, Relief and Rehabilitation, who is presenting in Burmese, of course, with translator, the eloquent Mr. Cha Win Oh. So that will be followed by Mr. Vishnu Mahat, Weapon Contamination Coordinator from ICRC, Myanmar Red Cross Society. Over to Myanmar, please.
DG Sabaya. DG Biobaya Babi.
Oh, so you are ARMAC Executive Officer, Nanga Kudaleri, International Organization of Pingla Balu, Usopana, Yojayane, Patalu, Chijabama, Japari. No, but my Vivo, Chamaro, General COVID-19, General Myanmar Education, Lolo de Yatani,
Next slide, please.
Yeah, the Manangama, Lenagan for such a question, MCA Lematura, Sewa Shide. Now the non-government control area, government control area, now terrorist
next slide, please. Next slide, please.
Jamulu, Cantamude, she, Kidwa, Cantachete, she, Camnema, IDB Canema, Cantamude, she, MI Longania, Yatani, so that John, so no do about it.
Dwayne, next slide, please. Okay, good afternoon, everyone. I would like, my name is Joey Wu. I'm just, because of the limited time, I would just briefly translate into what Mr. Had said. So in Myanmar, this slide is related to the first question, how has COVID-19 impacted on my ASEAN generally and URE in particular? So in Myanmar, due to the COVID-19 pandemic, most of the organizations have stand by the group awareness raising URE activities in Myanmar. So what we would like to mention is that Myanmar has 18 EAOs, ethnic organizations, and 10 out of them have already signed the nationwide ceasefire agreement, NCA. And there is a non-government control areas as well. So EORE is needed in the areas where those EOs control and IDP camps. It is important to continue EORE as incidents are still happening in this area. However, travel and access restriction due to the COVID-19 hinder the EORE activities in those areas IDP camps. Over. DGပြောပါခင်ဗျာဒုတိယချက်
အိုင်းလုပ်ငန်းစဉ်တွေမှာအခုလိုပဲဒီကန့်သတ်မှုတွေရှိနေတဲ့အတွက်တခြားနည်းလမ်းနဲ့ဆိုလို့ရှိရင်တော့ phone application တွေ FM radio တွေရုပ်မြင်သံကြားတွေ media တွေ social media တွေ text message တွေကနေပဲဒါပြောင်းလဲပြီးတော့ကျင့်သုံးပေးနိုင်တယ်လို့အကြံပြုဆွေးနွေးလိုပါတယ်
So this is related to the second question, the alternative approach to deliver URE in terms of the COVID-19 pandemic. So since the face-to-face virus education cannot be done in this time, so my Asian actors are trying to use the alternative way, such as using the social media, local radio, TV, Facebook, as well as the distribution of the pamphlets and promoting the mobile app that have developed in Myanmar.
Now, General, Jamai and other Winitana, INC material, COVID-19 and Patate, awareness they are Tolo, Nida, Shiva. Yana Sunway Bido, be a chain, Chitaluwe, Mayane, Tipina Pinele, Sassaniva, social distancing Kesari. Now, we are Nilu, the Pisidu, Akawa Yubido, Shantiame Hari, Dariale, the Amujini Aledi, COVID-19 awareness that what to get there. Maybe a chain, Yonle Tobu, Pina, P1 9, Nagaye, Lanza the Kubelu, Sunulu.
Yes, this is related to integration of COVID-19 risk education messages to the existing EORE messages. The COVID-19 information, education and communication material, IEC materials are published by Ministry of Health and Support, are available, and we are distributing those IEC materials to MyASEAN organizations to be used in the affected area. And COVID-19 education messages are integrated into the existing EORE messages for affected behavior change. For example, like stay away from suspicious items and keep safe distance for EORE. And for the COVID-19, like stay home and keep social distance. Over.
နောက်တစ်ခုကတော့ကျွန်တော်တို့ remote area တွေ remote area တွေနောက် IDP camp နေရာတွေ conflict ဖြစ်တဲ့နေရာတွေမှာတော့ မိုင်းအနေနဲ့ကင်းရှင်းလှုပ်ရှားမှုမိုင်းအနေနဲ့အသိပညာပေးလုပ်ငန်းတွေကတော့လိုအပ်နေတာဖြစ်ပါတယ်ဒီလို COVID ကပ်ပြီးတည်ငြိမ်သွားရင်တော့မိုင်းအနေနဲ့ကင်းရှင်းရင်းနဲ့မိုင်းအနေနဲ့အသိပေးလုပ်ငန်းတွေကိုတွဲဖက်ပြီးတော့ဒါတစ်ချိန်တိုင်းလဲဆောင်ရွက်သွားနိုင်မယ်မျှော်လင့်ပါတယ်။ဘာဖြစ်လို့လဲဆိုတော့ COVID ထိန်းချုပ်ရေးနဲ့ပတ်သက်လို့ဒီ NCA လက်မှတ်ထိုးထားတဲ့လက်နက်ကိုင်အဖွဲ့အစည်းတွေရော NCA လက်မှတ်မထိုးထားတဲ့လက်နက်ကိုင်အဖွဲ့အစည်းတွေအားလုံးကိုပါဒီ COVID နဲ့ပတ်သက်လို့ awareness တွေ INC material တွေကတော့တောက်လျှောက်နိုင်ငံတော်အနေနဲ့ပူးပေါင်းပြီးတော့ညီတူမှဒါ no one left behind ဆိုတဲ့မူနဲ့လေးပြီးတော့စောင့်ရှောက်နေတဲ့အတွက်ဒီကိစ္စကလည်းဒီငြိမ်သွားတဲ့ခါမှာဆိုလို့ရှိရင်တော့အတူတူရှင်တွဲပြီးတော့ဒီနေရာတွေမှာခက်ခဲနေတဲ့နေရာတွေမှာ COVID ရဲ့ထောက်ထားတဲ့လမ်းအတိုင်းပဲအတူတွဲပြီးတော့မိုင်းအနေကင်းရှင်းရေးအသိပညာပေးတွေလုပ်နိုင်မယ်အခုလက်လောတော့မိုင်းတန်ခံစားရတဲ့ quarantine ဝင်ရတဲ့သူတွေကိုထောက်ပံ့နေတာတွေရှိတယ်မိုင်းတန်ခံစားရတဲ့မတန်ဆွမ်းတဲ့သူတွေကို in-case ဒါမှမဟုတ် in-kind ဒီလို assistant တွေတော့ကျွန်တော်တို့ကလိုအပ်နေမှာပဲဖြစ်တယ်လို့ဆွေးနွေးလိုပါတယ်
So EORE is needed in the hard to reach areas, in government control area, as well as non-government control area, which is controlled by the ethnic organizations. And when the situation is calmed down, so we can accelerate the MyASEAN activities, including EORE in those areas. So with no one left behind strategy of the government, the Department of Rehabilitation is providing COVID-19 prevention and control measures in community as per the guidance of Ministry of Health and Sport, especially to disabled during the disabled, including survivors of landmines and ERW in quarantine centers. Over.
နောက်တခြားကိစ္စနဲ့ပတ်သက်လို့တော့ Mine အနေနဲ့အသိပညာပေးဆောင်ရွက်နေသူတွေအနေနဲ့ကျွန်တော်တို့ Mine Action Authority မဖွဲ့စည်းနေနိုင်ပေမဲ့လို့ကျွန်တော်တို့ National အဆင့် Mine Action Working Group ဖွဲ့ဖို့အတွက်ကိုကျွန်တော်တို့နိုင်ငံတော်အတိုင်ပင်ခံရုံးဒုတိယဝန်ကြီးဦးစီးပြီးတော့ဖွဲ့စည်းဖို့ Working Group ဖွဲ့စည်းဖို့ဆောင်ရွက်နေပါတယ်အခုလာမယ့်22ရက်နေ့မှာလည်းနိုင်ငံတော်အတိုင်ပင်ခံရုံးကဒုဝန်ကြီးဦးစီးတဲ့ဒီအဖွဲ့နဲ့ဖွဲ့စည်းနိုင်ရေး working group ဖွဲ့စည်းနိုင်ရေး Mine Action working group ဖွဲ့စည်းနိုင်ရေးဆွေးနွေးကြမှာဖြစ်ပါတယ်ဒီအဖွဲ့တွေဒါအတည်ပြုပြီးတော့ဖွဲ့စည်းရပြီး TOR တွေရှိလာပြီဆိုလို့ရှိရင်တော့ဒီ Mine Risk Education ပေးတာတွေ Mine Clearance လုပ်တာတွေတော်တော်များများတွေထိထိရောက်လုပ်သွားနိုင်မှာဖြစ်မယ်လို့ညွှန်လင်းရပါတယ်ဒါအပြင်ကျွန်တော်တို့ IDP camp တွေအများအပြားပိတ်သိမ်းမှုအတွက် National Strategic Plan လည်းရေးဆွဲပြီးဖြစ်တဲ့အတွက်ဒါတွေကိုအကောင့်ထဲပေါ်တဲ့နေရာမှာလဲဒီ humanitarian demining ကိစ္စရပ်တွေကတဖြည်းဖြည်းနဲ့အကောင့်ထဲပေါ်သွားနိုင်မှာဖြစ်ပါတယ်ဒီချက်ကိုရေးကြည့်တဲ့ Mine အနေနဲ့အသိပညာပေးလုပ်ငန်းတွေကတော့ဆက်လက်ပြီးတော့တိုးမြင့်ဆောင်ရွက်သွားမယ်လို့ပြောကြရင်ဒီကုန်းချုပ်ပါတယ်ကျေးဇူးတင်ပါတယ်
Yes. Even though Myanmar doesn't have the national MyASEAN authority yet, we are planning to organize a working group to establish Myanmar MyASEAN authority. That will be shaped by the Deputy Minister of the Ministry of the State Councilor Office and other members, including the peace committees and peace committee and other national reconciliation and peace center. and also as well as a joint ceasefire monitoring committee. So in coming 22nd of May, there will be a meeting to form a working committee for the establishment of National Migration Authority, headed by the Deputy Minister of Ministry of the State Councillor Office, and they will be discussing about to develop the TOR of the working committee. And when the TORs and were agreed, it will enhance the EOR activities, especially in the conflict affected areas. And right now, due to the COVID-19 and the preparation, we are on hold and hope to resume soon. And another one is that migration activities and procedures are included in the national strategy for resettlement of IDPs and closure of IDP camps in Myanmar. So thus, EORE and humanitarian demining will be carried out accordingly to the strategies. Over. Yeah, that's all from Myanmar side. Over.
Thank you. Thank you very much. It's you've done a lot of work on coordination and used technology to reach difficult areas. Good luck with your we hear now from Vishnu, please. Is right?
Oh, sorry, we hardly hear you.
Right. Is Mr. Vishnu on the line? Oh.
Good afternoon, everyone. My name is Vishnu Mahat. I'm the coordinator for Icrc Weapon Contamination Program in Myanmar. Well, most of the activities are well covered by the disease presentation. So basically, I will focus more on the activities conducted by Icrc and Myanmar Red Cross Society jointly. So are we, I'm just a bit confused. Are we sharing the slides? Am I supposed to share the screen or?
I think Kia will be projecting your PowerPoints shortly. But please, do we have it? Do we?
Yeah, we do have it. Just a question, Vishnu. Do you want to operate from your side, you said, or you want us to share?
We can see it now clearly, Vishnu.
Yeah.
So yeah, go ahead.
Okay, never mind. Oh.
Sorry for the glitch. So are you like proceeding to the next one?
Yeah.
Okay. Yeah. So normally the activities, joint activities from Myanmar Red Cross Society and Icrc is we have the full package of doing the prevention activities, like what we call risk awareness, safe behavior activities, to the casualty evacuation from the affected areas. It covers the overall war wounded, weapon wounded casualties. Then we also go and provide immediate, quick cash assistance, especially for the weapon wounded casualties, and basically my department provides for what we call weapon contamination casualties. So basically it's more like mine, ERW, ID victims, for civilian population. And then we have a separate department, physical rehabilitation department. Basically it's more physical rehabilitation support and their reintegration back to the society. Next, please. So here, comparing with 2019, Basically, this data, which I got mostly from the media monitoring and also some reports, we already have 115 incidents involving approximately 150 civilian casualties from mines, ERW, and IEDs. And this is more than the figures from last year during this time. And what we also see the impact of COVID might, if it gets even worse, is maybe it will lead to further displacement of the population due to the lack of essential services, plus also the IDPs which are currently in camp might go to their places of origin without the place being actually cleared or checked for the weapon contamination hazards. Next, please. So basically, it's also hard for the organization involved for victim assistance to provide the victims, be that be cash assistance or the rehabilitation support as of now. And already, as the DG mentioned, so basically most of the mine action activities or face-to-face risk awareness, safer behavior activities has already been halted. It's also halted from ICRC and MRCS side, but also halted from many other stakeholders. And here, what ICRC and MRCS used to do is we used to work in more than 68 different townships across Myanmar using the Red Cross volunteers who are based in communities in most of the affected states like Kachin, San, Rakhine, and also in Chin, but also in other affected states in the south. Next, please. So what we have been doing as of now is we're trying our best to deliver the urgent cash assistance which we are providing as much as possible. And then another is we have been using the communication tools and social media platform of ICRC and MRCS, plus also we have already broadcasted in MRE animation video in Rakhine twice a week. This will continue till few more months. But also we have been doing something similar about the radio spots in Kachin in local language. Plus also we have been looking for some other options in San and other national medias. Plus also we have been looking into installation of risk awareness billboards, and as others mentioned, we have been also dropping the MRE posters, leaflets, coloring book, crayons, etc. in the IDP camps, plus also in the health center, etc. Next one. Yeah, so as I said, normally our risk education sessions used to be combined with the ICRC and Myanmar Red Cross Society's relief distributions, be in what we call economic security or relief distribution, plus also like wash, sanitation activities, and this will continue. Definitely, we are using all the protective measures and guidelines for COVID-19. And as I already said, so basically we are also looking more deeper into integration of EORE or RASB messages into COVID-19 messages through our network of the Red Cross volunteers in the communities. And again, we're also looking into publishing some integrated MRE leaflets, posters, which will be installed in the IDP camps. I think that's all from my side.
Yeah, thank you, Vishnu. Obviously, you have a very tough job, and good luck with that. We're a little behind time, so we're going to go straight to Thailand to Lieutenant General Sitipol Nimnuan, Director General of the Thailand Mine Action Center, to see what's going on in Thailand. Do you have any mines left there, or have you already cleared them?
Good afternoon, everyone. TMAC is glad to share with you what we have learned about the EORE during the time of pandemic. start with the first slide. Next, please. Okay. To answer the first question, the COVID-19 is affecting all TMAC's mine action activity. The travel for operational oversight and quality management is limited. Even the International Day for Mine Awareness has to be cancelled and done through social media on the right-hand side. The demining work are slightly affected because most of the remaining mine areas are not near the community. However, the mine risk education and victim assistance activities are restricted. For the right picture, our demining unit, the relocating unit, is subjected to have all personnel undergo the 14-day health quarantine. This causing operational downtime. Next, please. This picture shows that our traditional MRE activities, including the face-to-face meeting with the community, are limited. Next, please. As this time of the year, it is the early rainy season. The list of mine accidents increase as local people will venture into the mine contaminated areas looking for forestry goods to sell. In this picture, you may see that some mushroom price can go up to $20 per kilogram. These wanderers are not only the local villagers, but also the people from other villages who not be aware of the landmine situation, which resulted in the unfortunate accident. TMAC usually dispatch our MRE staff to inform the target group to lessen the chance of the mine accident. However, the COVID-19 limit our traveling, so we need alternative approach. Next, please. To answer the second question, TMAC's alternative approach to MRE is the village health volunteer, or we call VHV. TMAC look to utilize the VHV as the potential MRE message disseminator during the pandemic. The Village Health Volunteer Project was established since 1977 for more than 40 years under the Ministry of Public Health. The volunteer will help people in rural areas promoting health behavior change. Each team of volunteers will be responsible for daily inspection of 10 to 15 households. Thus, the volunteer become crucial in stopping the COVID-19 spreading. Their works have been praised nationally and internationally, including at the World Health Organization. Next, please. Initially, our demining unit will select the area heavily affected by landmines due to our limited resources. After that, our demining unit will approach the volunteer team and instruct them on basic MRE. The demining unit will then accompany the volunteer during their daily visit. This allows the volunteer and our demining unit to conduct effective MRE to the intended target group without taking tolls on the fight against the COVID-19. Next, please. Despite all that, TMAC can still rely on some kind of traditional means. For example, the local radio broadcast, as well as the existing local MRE network that surpass travel limitation. Next, please. For the third question, the integration. Since the Thai government promote the integration to fight against COVID-19 at all levels, therefore, TMAC start to integrate our MRE effort at the local level. The aim is to support the behavioral change for both the COVID-19 and landmines by providing personnel and equipment support. In this regard, MRE effort and COVID-19 prevention can go together without sacrificing the overall effectiveness. Next, please. Lastly, I would like to take this opportunity to thank ARMAC for giving us the push to seek for the idea to conduct MRE, despite the limitation from COVID-19. Thank you.
Thank you very much, Lieutenant General. We now go to, we'll go straight to Vietnam for two speakers. Ms. Nguyen Thuan Phan from the IORI and Victim Assistance UNDP, followed by Ms. Helene Cooperman from Mindset Advisory Group. Thank you.
วันนี้เป็น expert ด้าน MRE ของ ARMAC เขาเป็นคนออสเตรเลีย
Thank you.
Hi. Hi everybody. So I'm the risk education and victim assistance managers. Can you show the presentation? So UNDP Vietnam is implementing the Korea-Vietnam My Action project. It is funded by Korea International Cooperation Agency. Can you show the next slide, please? The project is implemented for 2 years from 2018 to 2020, and the extension request for 1 year is being processed. So the project is implemented in 2 provinces in the central Vietnam, Quảng Bình and Bình Định. You can see in the map with the red circle. No, back please. And the project is implemented by UNDP in partnership with Vietnam National My Action Center, VNMAC, and Ministry of Labor, War, Invalid and Social Affairs. The project has 5 components: survey and clearance, EORE, victim assistance, information management, and capacity building. So if you want to have further information of the project, please go to the website of UNDP and or the website of projects. Yeah, next please. So relating to the Vietnam COVID-19 response, you can see that in Vietnam so far 320 cases have been diagnosed with COVID-19 and 60 cases are under treatment. 260 recover and no deaths. And as you know that Vietnam has successfully implementing the COVID-19 response strategies, including social distancing, contact tracing, and nationwide communication of COVID-19 on radio, television, and other channels. Like other countries in the region or in the world, due to the COVID-19, all sectors were affected, including the My Action activities, survey clearance, explosive ordnance risk education, victim assistance, and information management. Naturally, all the government effort focus on the response to COVID-19, so all other activity are affected. And I think that like other countries, we still don't have national guidance on how to conduct EORE in the context of COVID-19 for the affected provinces. Next slide, please. So, but UNDP Vietnam and the project found some synergy between the COVID-19 response and EORE. Vietnam has successfully implementing a series of the COVID-19 communications. For example, Vietnam government has like the very famous song, and it was quite popular among the people in the country. So I think that this similar style may consider to be applied to EORE. The COVID-19 message also delivered via poster and leaflet, and for sure it also can apply for the EORE in the project. The government also send SMS or voice message of COVID-19, for example, like social distancing, staying home, hand washing, reporting to authority if you found any case or you have some symptom of the COVID-19. So I think all the things we may consider to replicate it for EORE. And EORE message also targeting the risk education on social media. I think that which is also similar to the banner COVID-19, which appear on the social media. So for example, like on the Facebook or Zalo. So I think all the things of the COVID measures can be replicated and for the EORE. Yeah, next please. So for our project, we have some EORE delivery strategy in the context of COVID-19. Our plan, we will organize the instruction of EORE for communal collaborators or communicator for them to prepare the article in order to post or to disseminate or broadcast on the communal radio station. We also plan to organize the internet-based competition of EORE initiative for school children. We will pilot the EORE ads on the social media, for example, like on Facebook. And another thing that we will produce the EORE comics for distribution to the school. And recently, UNDP successfully conducted internet-based rapid assessment of social economic impacts of COVID-19 on PWD and universal survival. So you can get the full report of the assessment in the link on the screen. So I think that that is some sharing from our projects. Yeah, thank you so much.
Thank you so much. Obviously, Vietnam has been a global superstar in responding rapidly and effectively to the COVID virus, given your 100 million population, and also be very active in using multimedia or explosive ordnance risk education. So congratulations to Vietnam. Also, let's hear from Mine Advisory Group, please.
Yeah, thank you, Ha. Do you hear me? Thank you all very much, and particular to our colleagues and friends from ARMAC. Thank you for convening such a quality webinar and giving us the opportunity to share our experience. I will not give a full picture of how MAC Vietnam has been operating in this time of pandemic, but I would like to focus on presenting to you one particular approach that we have been working on for a couple of years now, and which proves to be quite interesting in this pandemic context. So focusing more on the question 2 on presenting alternative approach to EORE, I would like to introduce the pilots that we, MAG globally, are working on with Facebook. Next, please. Give you quick background information snapshot. The project was initiated back late 2018 by WRA, US Government Department of State Bureau of Weapons Removal and Abatement. They had been approached by Facebook to secure $25,000 of Facebook ads, and they were looking at innovative ways to reach people with risk education messages. At the time, they reached out to the Iraq Directorate of Mine Action and MAG to initiate a pilot project. So this is how we started, and we led a project from August 2019 to November 2019 in Nineveh Governorate, with the aim of reaching 80% of the 1.1 million of Facebook users in that area. So the project was really focusing on using on a large scale Facebook ads, which provide a very cost-effective way of reaching large amounts of people, engaging 2 ways with people while avoiding face-to-face, and supports high quality targeting in terms of age, language, gender, location. So quite have a large spectrum of functionalities, and can support overcoming limitations in terms of geography, security, or any type of access like we face today in the time of pandemic. And it has a significant potential to scale up, which we are now in the second phase, where Vietnam will be among other countries that will be trialing the project. Next slide, please. Just give you a snapshot of examples of what we used during the pilot in Iraq. So the basis of the ad were posters, existing posters that MAG Iraq has been working on with Iraqi mine action authorities. All posters, so 4 posters were used and adapted for Facebook, led directly to a dedicated website which gives all information about all safety messages, and there was a form to report threats. So that gives you an example of how the ads engage with people with comments and reactions. So people targeted were aged 13 to 65, and that represented 1.1 million. Next slide, please. So the pilot proved to be very successful in that context, in that area. We aimed at reaching 80% of the total population in that governorate, and we actually reached 90%. So it was a good success with 29 million times views for all our ads, with just below 1 million unique viewers. So that was great impact, viewers, and thousands of reactions. And the most important bit here is that it costed just over $13,000, which represent 53% of what the budget was originally available. So even more cost effective than what was originally anticipated. The community liaison teams led an in-country monitoring and evaluation. Of course, not only you have to deliver message, you have to ensure that the message is understood. And as it was mentioned earlier, what we are aiming at in risk education is changing behaviors. So how do we monitor that? So we led our CLT teams in Nineveh, led surveys to 215 participants, which showed great impact, immediate impact, with the survey being conducted a little bit over a month after the campaign, with 94% of people understanding the risk, 66% recalling at least part of the messages, and 83% said that it gave them good information on how to stay safe. Next slide, please. So of course, it's not without challenges. Messages on Facebook can be one way. So we have to further assess how to engage more with users, not only delivering risk education, but engaging with them, which requires capacity. And this is one of the key findings here, is that we didn't have dedicated capacity. MAG used the team that were already working in Iraq. We used materials that were already existing. So we feel that we delivered a modest rollout of activities, which leave a significant scope for further testing and improvement. We felt that further investigate in video, quizzes, or live performance, using all the different functionalities of Facebook could really trigger more and more traction and retention of messages. Of course, capacity and budget will be key to effectiveness of this kind of project. So this next step is to scale up the project, scale up in terms of capacities, and scale up in terms of countries and context. Like mentioned earlier, this is a Facebook project, so it needs to be adapted to the national context and the link with Facebook. We are aware that it might not fit all contexts, but there is a significant opportunity worldwide to use that mean of communication, really reaching the right people at the right place using a cost-effective way. So the next countries that will be entering the second phase of the project for MAG will be Bosnia and Herzegovina, Lebanon, Mali, Somalia, and Vietnam. If you can go to the next slide. So what's for Vietnam? With over 45 million Facebook users, so that's just below 50% of the population, total population in Vietnam. In particular, a majority of people aged 18 to 34 years old are using Facebook, 50% of male, which represent a big chunk of the target of risk education in Vietnam. So we feel there is a really a good aspect of using digital risk education, maybe complementary to existing risk education, not replacing, but certainly enhancing what is existing. We will be trialing the project in Quang Tri and Quang Binh provinces, where we already operate, and targeting farmers, adults, teenagers, and primary school children, which are the most at-risk population according to studies, particularly led by CRS. We have a vast range of existing resources that we can use and adapt to Facebook, resources that have been tested already in the field and already approved by the national authorities. It will be key to really engage with the authorities as we pilot project on those two provinces in a way to identify potential for scaling up nationwide, if that is if it proves of interest. Building on the findings of the pilot in Iraq, we will be looking at developing additional content to engage more with users, which was really one of the key findings from the pilot, using more the functionalities with dedicated capacity to respond to comments, to engage live performance or quizzes, really bring a leverage to the messages. The community liaison teams are leading on this project, as they are in charge of risk education, and they will be integrating surveying as part of their routine activities to make sure that we are going in the right direction and it's giving positive results. There are other social networks that we are looking at, not only using Facebook, but we've been contacting Zalo, in particular for Vietnam. And I know social networks were mentioned across countries, so we all feel there is potential there. So we look forward to this second phase and presenting the results to you. Thank you.
Thank you, Helene. Thank you so much for sharing. Minds Advisor Group's experience of reaching so many people, both Vietnam and around the world. We really appreciate your sharing of that knowledge. So just to wind up this agenda item, I must say I'm so encouraged by the response of the mine action sector. You know, looking around the world, many countries have been very badly hit, have been slow to react, have been resulted in chaos, paralysis, and really have not handled the situation well. But if you look at the 5 countries we've just discussed, it is so encouraging to see the rapid response, the effective response from authorities and the international and local NGOs. So I'm really happy to hear these reports. There is an enormous amount of information we've just heard over the last 40 minutes. That will be available. ARMAC is recording all of this webinar and the PowerPoints. There's an enormous amount of information which ARMAC will share later. So thank you so much for all of that input. We're going to move straight to agenda item 3, public health, the health crisis and mine action. It gives me great pleasure to introduce Dr. Jo Durham from Queensland, Australia. She's a senior lecturer in emergency and disaster management at Queensland University of Technology. She has over 10 years of experience in working in international health and development in Laos, Cambodia, South Sudan, Lebanon. I could say a lot more, but I'll have to bridge the gulf from mine action and health knowledge. So Jo, please have the floor.
Thank you, Hal, and thank you, ARMAC, for giving me the opportunity for this presentation. It's very much appreciated. Having looked at some of the attachments that came through with the emails and the report that came from Myanmar today, and also hearing the discussions and the presentations today, I hope I'm going to have something to add to this. Could we, just sorry, a word of note though, that I will most probably say physical distancing, not social distancing. So if I say physical distancing, I'm referring to social distancing, and that's because I work in public health and we think social connectedness is important for our health. Could you go to the next slide, please? So I work in public health, and public health is really about the whole population's health rather than individual health. And we look at patterns and causes of disease and risk factors for disease. So we're really looking at promoting the health of all people and to prevent injury, premature death and disease. And we particularly focus on inequalities in health outcomes, which I think is particularly important for countries who've been affected by conflict or UXO or other exploded ordnance contamination, because not only does that have a direct effect on people's health, it also prevents access to things such as safe water, shelter, housing, and a nutritional diet, all the things which people need to promote health. Could go to the next slide, please. So in injury prevention, in public health, we don't talk about accidents because public health is really based on the idea that injuries are not accidents. They are predictable and preventable events. We know, for example, if someone is mishandling an item of UXO or they hit an item, we know that that is likely to explode and cause injury. And we know the practices that are likely to prevent people from being injured by UXO or other kind of explosive ordnance. And so often, that's why often in public health, we focus on the behaviour of people and monitoring and tracking frequencies and rates and trends in injuries. So we would normally, if there was injuries, we would normally report them as per 10,000 of the population or per 100,000, whatever. So it gives us a better idea rather than just raw numbers. As we see, COVID-19 is also reported like that. We need to understand how and why people make choices, and certainly in terms of mine action and explosive contaminants, we know that often it's through its livelihood choices or around protecting people's families. And we look at risk factors such as, so risk factors could be male or gender, age, ethnicity, a place where people live, their livelihoods. And then, as we do in Minor Action, also then look at strategies and allocation of resources to have the best kind of bang for our buck. Could you go to the next slide, please? I hope you can see this. What we can see here is in the low risk square, this is where people have a high familiarity with the hazard. So in the case of talking about explosive ordnance, if people who live day to day in their everyday life, they are living in an environment that is contaminated with landmines, UXO or other explosive ordnance, they have a high familiarity and an understanding of the hazard. If at the same time they also feel that they can control have control in some way, maybe they may have voluntary interaction with the hazard, then they tend to have a low risk perception. So for example, we found in a study in Laos that male victims would often move items, particularly those that were surface items. They thought they were kind of familiar with them. They'd lived with them for 20, 30 years, maybe longer. They felt that they'd seen other people move them, that maybe had experience of moving them, and they voluntarily interacted and moved that item to another place, often so that they could get on with their work or also to protect their family. So their perception of risk was low because of their familiarity. They thought they could control the risk, and there was voluntary interaction. And that's what we find with a lot of people who've lived in a explodance ordnance contaminated environment for a long time. It's probably one of the barriers we have in behaviour change as well. On the other hand, if it's something new, it seems catastrophic, and we don't really have all the information about it, our interaction with it is involuntary, then we perceive a high risk. And this, of course, affects our behaviour. So going back to the example from Laos, what we found is that people had a much higher risk of interacting with ordnance that was subsurface, and they couldn't see because it was unknown, and they couldn't control when they interacted with it. So then they had a higher perception of risk and were more likely to take risk avoidance. Oh, sorry. Sorry, I just hear that some people can't hear me. I'll try and speak louder. And my mic seems, my mic is working.
Joanne.
You can hear me?
Yes, yes.
Okay, so some other people can too.
Yeah, I think you might be back.
We are here also, been hearing you quite well.
Okay, maybe I just dropped out for a short time.
Yeah,
so
continue.
High fear, low familiarity, people will have a high perception of risk and will try and take risk avoidance behaviour. The other example with this, we see this now, is with COVID-19. It's something new, it's changing all the time. We don't really understand it. It seems very catastrophic, especially, I live in Australia, but I'm from England. Seems very catastrophic if you're living in some countries particularly. So we have a higher perception of risk. Could you go to the next slide, please? So in risk education, we really need to think, how do people assess the risk? That's one of the first things that we need to know. And how does that risk assessment inform their behaviour? As in the example I gave before, where they have high familiarity, voluntarily engage with the hazard, then that informs, they do their risk assessment based on that, and that informs their people's behaviour. And people also need to think, when we ask them to do something that is different, they need to think, well, can I do that? Is it feasible? Do I have the resources to do it? What will happen if I do this behaviour, the new behaviour that you want me to do, and the one that I'm currently doing? So they'll weigh up the costs and benefits. And certainly what I have seen in Laos and some other countries is that people will weigh up the risks and the benefits, and sometimes the risk may be a lack of food on the table compared to, well, I might hit a UXO as an example. So when you weigh that up, most people will generally prefer to have food on the table because that's something that is known. So it also depends on what other options people have to avoid the risk behavior. So what may seem as risky to some people is perfectly rational and sensible and perhaps the only obvious choice to others. Could you move to the next slide, please? So when we're thinking of public health messages, and we could apply this to mine risk education messages as well, we have to think about, well, who is it that we're talking to? Who is the person who is going to receive the message? And put ourselves in their shoes, understand their particular context, whether the particular threats or hazards to their health, or what actions can be performed, and what are the benefits from our target recipients in actually performing those actions. So again, remembering that people will weigh up benefits or consequences and risks, and they may assess risk in a different way to people who don't live in a contaminated environment. And remembering that what we may see as risky behaviours are normally rational to the person who is doing them. Could I go to the next slide, please? Here, I won't read them all out, but here are some of the things that we need to think about when we're constructing our messages. And here, when I'm talking about unhealthy choices or healthy choices, here we could think about that in terms of preventing injuries. And again, you can see that I've got down here, how will the behavior that we want people to do, how will it help them? And again, when we're thinking about that, we have to think about it from the perception of the people whose behavior we want to change. And we have to consider what makes it difficult for the target audience to change. And often there may be things that we can't immediately address, things related to what we call the social determinants of health. For example, related to poverty, or where people live, the type of land or the type of livelihoods that they have access to. It's also important to show visual images. When you're having visual images, they should show the action that you want the person or you want the community or the population to actually do, not the things that you don't want them to do, because that can give a conflicting message. So to be really clear, if you show people what you want them to do, it's maybe more effective. Can I go to the next slide, please? Thank you. I don't really want to talk about this too much, because I think already you've given lots of examples of things that what you're already doing. If you do incorporate COVID-19 into EOR, then I would suggest really make sure that everything is aligned, which I'm sure you are, with Ministry of Health. These are some of the things that we would talk about: good personal hygiene, physical or social distancing, symptoms, and telling people to avoid touching their face with their hands, and especially rubbing their eyes. Some of the things we may do, I think I read it in one of the reports, is giving soap to people. For some people, soap is very expensive and difficult to access. I think we do have to be careful, and the gentleman from HI alluded to it as well, that we don't confuse people or give people too many messages and give a mix of mine risk education messages and COVID-19 messages. On the other hand, usually community liaison, mine risk education people and mine action teams are very well trusted and integrated into the community, which is also really important in people accepting and acting on messages. I think we just have to be a little bit careful. One way you could introduce some of the messages, prevention messages around COVID-19 is simply in your briefings. So when you're organizing an MRE session, for example, you could explain to people that you need everyone to stay about 2 arms apart. And that's another kind of, instead of 1.5 meters or 1 meter, I have to think about what that looks like. But if you say 2 arms apart, it can be a lot clearer for people, something visual. And so you could explain, we're going to keep 2 arms apart. Before we start, we want everyone to wash your hands for 2 minutes. You'll maybe have to find a song that lasts 2 minutes, so people wash their hands properly for 2 minutes. The other thing that potentially I think teams could do would be to look out for people with symptoms and refer them to the health facilities. I think we also have to be careful both with COVID-19 and with our mine risk education messages that we don't present things that are too difficult for people to do, because then they may feel shame and some kind of blame if they get sick, and we can potentially stigmatize people. Can I go to the next slide, please? Okay, this is just some interesting information for me as working in public health. But I just want to give you an idea of how COVID-19 is transmitted. And these 3,000, a single cough releases about 3,000 droplets, which can contain the viral, and they can travel for up to 50 miles in an hour. A single sneeze is about 3,000 droplets. Sorry, I thought I'd made a note of it. I can't remember the exact distance it will travel, but further. And it's also important to remember that most community acquired transmissions, so by that I mean ones that are not imported by someone coming in from another country, occur from people who are asymptomatic. That means they have no symptoms. And mostly they're transmitted at home, the workplace, public transport, social gatherings, and restaurants and communal eating. And I mention this because I think it's important for you and for us, we're about to go back to work soon, back to the workplace, I should say, to be thinking about the way workplaces and homes and dormitories, if they're used, or communal eating spaces are organized. But the important thing, I guess, to remember is that for COVID-19 to be successful, it needs people to be exposed to the virus for a certain period of time. And anyone who you spend more than 10 minutes with in a face-to-face situation, they are potentially infected. And anyone who you sit in the same office with for 10 minutes or more, remember they are also potentially infected. I should say some of these droplets are quite light, so that's why they can travel so far. Some of them, larger droplets, are quite heavy and they'll just fall to the ground, and it's because of these droplets that the evidence is a bit mixed, but some people are recommending wearing masks. Could you move to the next slide, please? So in terms of your protecting your staff and the communities that you work with, you really need to make sure that staff have regular and thorough hand washing, at least 2 minutes. They should know how to properly wash their hands, as you can see in the diagrams here, or use an alcohol-based rub. And when you use the alcohol-based rub, they should know that they really have to rub their hands until it's dry, their hands are dry. And they should do that before starting work, before eating, after going to the bathroom, after any contact with any co-workers or community members, and after touching potentially contaminated areas such as tables, doorknobs, taps, and after removing. So for example, with your teams, once they've finished their work and maybe they take off their visors, they must wash their hands or use the alcohol rub, or they should do this, I should say, before they touch their face with their hands, and particularly their eyes. Also, you can have things such as hand hygiene stations around. The alcohol-based rub can be around in prominent places and accessible to everybody. And masks, yeah, depend on, see what local advice is on masks. I know they're quite common in a lot of ASEAN countries. They definitely won't hurt and they may protect you. And also a safe disposable bin with a lid. Can I go to the next slide, please? Okay, this is a study. I just wanted to give you an idea, particularly if you're in any communal spaces, of how easily the virus can spread inside. So if you won't be able to see, I don't think, my cursor, but you can see this table. This is a restaurant in China where they had social or physical distancing. This here, just behind table C, is an air conditioner. Okay, we look at table A. This person here, A1, who's at the top, says January the 24th at the top. This person was out to dinner with 9 friends, all physically distancing. This person had no symptoms of COVID-19. Let me see. And then you can see A2, A3, A4, and A5 all subsequently became infected from this one person at A1. In addition, table B, physical distance, B1, B2, and B3 became affected because they were sitting downwind from the air conditioner. Also infected were C1 and C2. E and F, not downwind from the air conditioner. Nobody at that table was infected. Can I go to the next slide, please? So just some other things, I guess. Remember, physical distancing doesn't always work, especially if you're inside. Okay, if you're outside, it's much more safer. You've got a much lower risk if you're outside. But if you're inside, the risk is higher. So when you're thinking about your staff, and if you've got communal spaces, think about those. It may mean that you need to have some temporary housing or other physical distancing protocols. Also, please keep a record of actions that you do in terms of disinfecting space and so forth. And also keep a record, which most people, organisations already do, of who visits your organisation, because that will really help with contact tracing, which in your countries you're doing very well at. Okay, thank you. I could hear a little ding, which I think is my time is up. And there are some references. I've realised, sorry, I have a couple of other papers around mine risk education myself that I didn't put up, but I'm happy to share them later. Thank you.
Please email them. Please email them to ARMAC, Joe. Thank you so much. You must be extremely busy at the moment. Your knowledge and research is critically important. The science is getting the science right, and science communication is about saving lives. So keep up. Good luck with your work. Okay, we're a little behind time, so we're going to go to agenda item 4. A view from the IORI advisory group. And now from the other side of the world, where it probably is sometime in the middle of the night, we are most grateful to have both co-chairs of the International IORI advisory group in video and in person. First of all, we have by video, Hugues Lorange from UNICEF, who has some really valuable resources for us. And also Mr. Sebastian Kassak from Mines Advisory Group. Please proceed. Sebastian, go ahead.
Let's go to the video of Hugues first. So looking forward to that, and then I will talk to the group. Thank you.
Good afternoon, everyone. This is Hugues Lorange, UNICEF New York. I'm happy to join this webinar. Actually, I would like first to share my word of sympathy with all of you. Many of you are sharing a difficult time, both personally and as well professionally. We have to struggle sometimes with multiple tasks, homeschooling, nursing at home, cooking, and in the same time dealing with hard deadlines for our work, including for this pandemic. So this is a very difficult time. Some of us have even are separated from their family members or may have lost a beloved person. It's a challenging time, and we need maximum solidarity, maximum compassion. And this kind of webinar does help share our good practices, share our lessons learned and our concerns in our own work. As we can see in this slide, we have you have on your left side these 2 children who are from Libya, and this is a real situation that happened to Bashir and Laila. A few days ago, they were walking on the street and a rocket was shot. So this is a typical situation that many communities are going through. We have to struggle sometimes with, communities have to struggle with different challenges. In this case, it can be both the pandemic and explosive weapons, including explosive remnants of war. So I will focus in this short presentation on what has been done in terms of knowledge management and in terms of guidance. I also would like to thank Sebastian Kassak for representing the IORI advisory group and to thank ARMAC for organizing this webinar. We actually started in March with a rich discussion through the International MRE Working Group. So this is Committee of Practice for Risk Education. We have more than 430 members there with many colleagues, friends from your region. And please do not hesitate to join this group, which is actually a forum of discussion on any topic related to risk education, including COVID-19 risk education. Through this group, we decided that we should actually organize a webinar with the IORI advisory group as well, and that was on April 1st. We had 47 countries participating, 28 organizations. So that was a huge participation for a webinar, and I'm glad that now it's happening at regional level as well. So in terms of the scenarios that we are facing these days, let me go through these 3 main scenarios that we are actually facing in our sector. The first scenario, typical scenario, is how can we safely maintain or develop IORI? a number of programs are struggling to maintain those activities and to adapt those activities. For example, by using remote approaches rather than face-to-face approaches. A second scenario is about integrating both EORE and COVID activities, including COVID risk education. This is happening in, I think, in Cambodia. It's happening in many other countries, and it's increasing. It's an increasing trend. Then we have a third scenario where actually EORE activities are replaced by COVID activities, entirely replaced by COVID activities. This is happening for not necessarily for an entire EORE program, but some aspect of the program. And in some situation for the entire program. For example, Hello Trust is very in the forefront of replacing all their traditional mine action activities by COVID-related activities. In terms of knowledge management, let me help you navigate through different resources that are at your disposal. I mentioned already the MRE working group. So when you have access to the resource library, I will make sure we'll share the link with you. You will get access to those folders that are all related to EORE and COVID. The first folder is actually a Word document about key links that you may use for your work with guidance from various sectors. It may come from communication for development, from WASH, water and sanitation and hygiene, of course WHO guidance, and etc. So of course child protection as well. So many guidance that have been developed. It's a selection, it's not exhaustive, but these are key links that we will update regularly. So you can use these. It's not designed specifically for the EORE sector or for mine action, but it's relevant to our work. So this is a concrete example. If we go back to the library, here, let's see other folders that you have access to. There's one on the webinar that has been conducted. This webinar will be also in this folder. Another one that may be of interest for many of you is how we integrate EORE and COVID with very concrete examples. So that one, this sticker and poster has just been developed last week, I guess, in Libya, with, you see, half of it is dedicated to COVID risk education and the other half to EORE and so on. So we have other examples that can be translated into English as well. Here's an Arabic version of what has been developed in Palestine. Again, it's COVID integrated with EORE. So this initiative, we hope, will come days after days, week after week. We hope there will be many more contributions, including from your side. There have been some initiative, of course, in your region, so we hope we'll upload them soon. There is a folder on resource for remote EORE. That's also essential, especially when we have to shift from face-to-face towards remote approaches, digital approaches. You have plenty of examples here. The GICHD, they are developing also a study. I mean, they have already conducted a study on various ways and methodologies to conduct risk education remotely on a digital way. So here, plenty of good examples from our sector and also from other sectors. I don't go into the detail here. Perhaps, I've been too quick here. So, and then you have other folders. Maybe I should come back. Okay, on folder 7 here, we'll get also SOPs and guidance coming from various organizations or countries. It's under construction. We'll hope we'll get more examples. Perhaps I should come back to the webinar that we conducted and the Q&A, because this is actually a specific tool that was developed by the advisory group and for specifically the URE sector. So this is an example of practical guidance that we developed and designed for you. So you have 15 pages of questions and as well as answers and guidance that will go with those answers. So you just click on the link here and you will get the appropriate guidance. So there was many questions from the first webinar. There will be more with this webinar that are addressed through this Q&A. So we hope we'll enrich this Q&A with this ARMAC webinar. And it's an ongoing process. It's a living document, so we hope you will also contribute to all that. I will stop here and hand over to Sebastian. And again, thank you and have a very nice webinar. All the best. Thank you.
Yeah, good afternoon. So I will take over from Uge. And my name is Sebastian Kazak. I'm the co-chair of the EORE advisory group and work for MAG, Mines Advisory Group, in a global role, roving role to support our programs as the community liaison advisor. Okay, if we can move to the presentation, I will take us through a quick presentation. Some of you may have participated in the webinar Hugues was referring to on 1st of April. My presentation is close to that, but adjusted it a bit to cover the situation in Southeast Asia. So yeah, it's coming up now on the screen, I can see. And on the advisory group, we exist like for 1 year now. If you want to learn more about the advisory group, we're like 12 agencies, including UN agencies and international NGOs, operators, to promote risk education. And you will find us on the Geneva International Center website. Okay, next slide, please. So I'll take it from a MAG position, and you will hear all the similarities what we already heard today. So normally we would be working in 16 countries doing risk education, but at the moment we are down to 4 because of that situation, and it includes Vietnam and Cambodia. It looks like Laos is going to start soon, and with Myanmar, less certain. So most are related to the COVID-19 rated stand down. It comes from national authorities guidance, including UN guidance, and we have to decide whether to resume or not, of course, in line with national guidance. Next, please. So as Joe already took us a bit through the public health side, we have the risk communication and community engagement language that comes more from the health sector. Then we have our experience with the EORE and community liaison work. So is it easy to integrate or not? And we definitely have common aspects. So we have the commonalities we've seen now in several examples: stay away, don't touch, report. We have a lack of knowledge. There's a lot of misinformation as well, myths going around that need to be addressed. We look at behaviors that range from acceptance to rejection. We have reckless people, but also people who are forced to take risks. So this is all familiar from the mine action side. People have to change their life patterns due to new risk. I know in Southeast Asia it's more a common old risk, but in Myanmar it's still there's still open conflict and contamination. So we have to ask ourselves, does the COVID-19 threat put people more or less at risk from explosive ordnance? And if we look at Myanmar, for example, people returning from as migrants and so on, IDP camps being closed into areas that are contaminated, they may be more at risk. But at first sight, you're thinking, well, people are in quarantine or can't move a lot, so they are less at risk. It's a sensitive subject, and we are used to that. Also, landmines, IEDs, etc., are a very sensitive subject. People fear retributions to talk about it. This is very similar to people who are afraid to reveal their status so that they may be sick and so on. Joe alluded to the topic of stigma. We are not so good in talking about stigma, and that's something our sector needs to learn. So we do have experienced community level work, but the new protocols we have to learn to work with, the spacing, the hygiene protocol, and so on. And Joe also said that, I mean, if we include, let's say, risk education messaging for COVID, and we say you should wash your hands and so on, so is there access to water? Is there soap? People should have space, but they live very crowded. So how could they do that? We have to watch out that we don't preach things that cannot be adhered to by the people. Next, please. So I'm going through 5 key considerations quickly. First is the health and well-being of MAG staff and their families is #1 priority. And it was also mentioned by Halo and other colleagues, we don't want to be the vector of the disease. So we have to be accepted by the population that they want to see us, and we have to definitely practice safe behavior ourselves. We have a duty of care towards our staff and family networks. I think the third point is important. So if we are working from home and so on, and we expect our teams, our national staff, hundreds, thousands of staff, to play a role in this response, they need to be able to have internet access, phone credits. Otherwise, how can they be working from home? So 2 final points, basically, how do we adapt our operations? And if they are suspended, how do we, when do we restart and again adapt? Next one. So the second consideration, we are delivering our operations, and that's our main task. We want to continue our normal work as soon as possible, but it's like a staggered restart often. I mean, putting out hundreds of deminers is in itself not that easy, acquiring safe practices. So it has to be adjusted, as I said. Face-to-face messaging, yes, but careful. And maybe, as we gave some examples, look more into using media as well, and SMS and so on. Maybe take the last point down here. So it says basically leave mass messaging to the pros. What do I mean by this? We know how to do our job in Mine Action. We are not public health specialists. We are not the COVID-19 specialists. So let's be careful. This was mentioned, especially when there is two-way messaging over the radio. For example, you have a radio show. Make sure this is done with the colleagues who are from the health sector, from the wash sector, hygiene, and so on. Let's stick to what we know to do best. Next. So an example from Myanmar, and we can share this study, a summary of less than 5 pages. So we have done with our existing network of community liaison workers a study, and we reached 520 communities just by calling the village leaders over the phone. So this is in our area of operation. We reached government-controlled areas almost 50%, mixed control areas nearly 40%, and non-government controlled areas as well, 12.4. So that's in Kachin, Kaya, Kayin, Shan, and Tanintarai region. So the topics that were covered was basically what's the knowledge on COVID-19? What do people know how to protect themselves, their communities? What's the existing access? So what assistance is available? And how does that new situation impact on their livelihoods? Interesting was a question on the migrants and IDPs returning to this village within the last month. And lastly, what are the risk education needs from their perspective? So the findings were 99% of the communities had heard about the virus, but more than half requested more information. And especially the non-government controlled areas really were eager to get more information from us to share with their communities. 44% of the communities reported that migrant workers and or IDPs had returned to the village in the past month, and that's higher than we had expected. And a bit low, we were surprised, only 15% requested risk education. And it seems that this was interpreted that the people, especially the newcomers, need risk education, but they were actually safe because they were inside the 28-day quarantine. So we think we will keep asking questions how to deliver risk education, especially to newcomers who do not understand, are not familiar with the local threat. Next. So the third key consideration is about the donors. As mentioned also by Halo, they are really positive to us. We have asked for additional funding. We mentioned that Facebook project looks positive. These things take time, but it's coming. Next. So the threat of COVID-19 will lessen, but not go away so easily. But the threat posed by landmines will remain for years. We hope by 2025 we will make a big difference. And so let's stay focused, do what we know how to do it best. But in this situation also, it's Mental Health Week. I think we really need to maintain contact with our staff, do the welfare checks, check that people have coping mechanisms to live with the situation. COVID-19 will not go away, possibly for quite some time. So as we have already been doing now, this is like 6 weeks ago that I presented this one. Let's be prepared and adjust our ways of working. There's a new language, COVID-proof your work. So some takeaways: don't become a vector yourself, do no harm, have SOPs in place, also for risk education. Will staff accept to work on this in the communities, to go out? Well, some people may be scared. We have to acknowledge that, and we shouldn't force people to work if they feel really uncomfortable doing so. Ensure the communities want us to visit, and if you do, be an example, applying the COVID-19 safety protocols. So even if we don't integrate COVID-19 messaging necessarily, we have to explain to the people why we are behaving differently, why people should wash their hands, why we are using masks, why we are cleaning all the chairs after the session, and so on. Reduce group meetings more house to house. I like the idea from the Myanmar team. They say, let's go family to family. So it's like a peer-to-peer approach. Also, messages can be sent on family to family. If we cannot go physically into the village, we can start working on remote messaging as well. Continue risk education, be creative. We have touched it, and those who are most vulnerable, whom are most exposed to the explosive ordnance threat, as usual, should be our focus. Next. Yeah, that's the closing slide. So everyone can make a difference. Thanks.
Thank you so much, Sebastian. We are so lucky that you guys, the work you are doing with the IORI advisory group, we're not alone because you are providing us with a wealth of information from all around the globe. And you just gave us an overview of the resource library that you are continuing to compile. And look, I encourage everybody to tap into those great resources and ideas and new technologies. It's so valuable. So yeah, keep up that brilliant work. And thank you for for both of your presentations. Good luck.
Thank you.
Now we thank you. Now we move to the open discussion, but I'm just wondering, given the shortage of time, it may be better if I'm sure people have questions. If they could post their questions on in the chat box, we could certainly follow.
Hal, I think we can give about 10 minutes for people to ask.
close. But the way you can leave.
All right. So yeah, I think Hal has some difficulty on the technical matter. So I just want to invite some questions if there is any. You can just unmute yourself and press the raise hand if you go to participant, and then you can find raise hand on the right side. Otherwise, feel free to drop any questions in the chat room, and we will address those in due course and share with you in a few days, including the key discussions as well. Anything from the floor? We hear from Jason, I think, and then Bayu. All right, so I think I just invite Jason first from MAC Cambodia. You can please unmute here.
Thanks, Dwayne. So yeah, so my question might be better to actually ask the group verbally, because it's going to be quite long. There's a bit of context I want to throw in here as well. So our question is really going to be to the wider group in general, because I'm very interested to hear that many programs are now relying on the distribution of posters and leaflets and other printed materials to share messaging around COVID-19, or even to share integrated messaging around COVID-19 and RE. And it's very good to hear that so many programs are being so proactive and are responding to this crisis so quickly. In Cambodia, MAG has so far been quite reluctant to distribute printed materials at this time. And there's a number of different reasons for this, as Sebastian was just talking about, and how a number of you have already alluded to. I mean, firstly, there's been an acknowledgement that we're not health professionals, we're not adequately trained to be sharing this health messaging. Secondly, there's been a decision to prioritise our core work, do what we do best, especially as the secondary effects of the virus are going to become increasingly felt in what are already impoverished communities. But also, and getting more to the point of my question, is because we have some concerns that these materials could potentially act as vectors for the spread of the virus. Okay, if the virus is present on these materials, we're potentially spreading them among the communities that we're there to serve. And some of you may have heard of the incident in Afghanistan a few months ago, where distribution of some IAC materials among government representatives resulted in numerous new cases because those materials had actually been contaminated with COVID-19. So my question to those programs who are distributing materials is, what measures are you taking to ensure that these materials are not going to become vectors for the virus? I mean, if you are distributing materials, what steps are you taking to make sure that those materials are not, in fact, contaminated with the virus? Thank you.
All right. Thank you, Jason. I'm probably just going to invite Bayu to get the question, and then I can hand over to speakers on responding it. Please, Bayu.
Okay, thank you very much. First of all, I'd like to appreciate and acknowledge the president organizer.
Bayu, we're losing you.
Unmute, unmute.
Me?
Yeah, can you repeat again, please?
Can you hear me now? Can you hear me?
No, it's great.
Yeah.
Okay.
Yes. Yeah, my question is regarding to this integrated messaging of COVID and Myanmar risk education. So which target groups, which at-risk groups, those organizations who are really conducting integrated messages, they pass the message, which risk group they are targeting, the first question. And the second one, really, now we are saying children are less risk of COVID, but they are at high risk for Myanmar risk. So really, to which group they are reaching, and at the same time, how really they can avoid confusing in passing the message. Thank you.
Thank you, Bayu. So I think we go back to the first questions on the concern on possibility that the printed materials can carry the virus itself. Maybe Sebastian or other speakers can take that question. Dr. Joe as well, perhaps.
Yeah, I can take it up quickly. It was part of the Q&A, so we discussed it. Definitely, the person who is basically packing, just starting the distribution chain, and so all people need to wear gloves in this sense. And you can look up using gloves is not that easy as well. It's not just about masks, also using gloves is a science in itself. So if you start from the principle before you do the distribution, then they use gloves and so on, you can really minimize the risk. But as I said, it takes a bit of training, I would say. Maybe Joe has something to add?
Yeah. Joanne. Yes.
I just added something briefly in the chat box to say, first of all, gloves, if they touch another surface and they're also contaminated, so we need to be not become complacent just because we're wearing gloves. And the other thing, I just replied to Jason saying, I did see something today, but I haven't seen the evidence yet or read it in detail about, and it was about kids returning to school and teachers doing the marking, that they could potentially be at risk. So I think, I mean, because it's a new virus, there's so much that we don't know about it yet. And as we start going back out of lockdown, we're probably going to learn even more. We're going to start learning more.
Right. Yeah, we got also some sort of reference of using the UV lights that can also kill the potential virus on unbreathed materials. So probably that one thing that can be considered. But is there any experience from each member states perhaps on tackling this, avoiding some threat on the contamination through printed materials before we go to the second question? Or otherwise, yeah, I think Bayu's question was more on how to distinguish the risk from one group of people to other group of people, considering that some group of people are having some more risk in specific cases. So what do you think? Maybe Julian or Sebastian? Any thought? I see from Myanmar, from UNICEF, Cho Win-u.
Yes, our Director General would like to compliment the Sebastian's presentation on the Myanmar studies.
Meg ဆွေးနွေးတဲ့ထဲမှာမြန်မာနဲ့ပတ်သက်တဲ့အကြောင်းအရာတွေပါတဲ့အတွက်ဒီကလှုပ်ဆောင်ချက်လေးတွေကိုထပ်ပြီးတော့ဖြည့်ဆွက်ပြီးတော့ဆွေးနွေးလိုပါတယ်ပထမတစ်ချက်ကတော့ဧပြီလ29ရက်နေ့မှာကျွန်တော်တို့လက်နက်ကိုင်အဖွဲ့အစည်းတွေနဲ့ညှိနှိုင်းပူးပေါင်းရေးကော်မတီနိုင်ငံတော်ကဖွဲ့စည်းခဲ့ပါတယ် COVID-19 နဲ့ပတ်သက်တဲ့ထိန်းချုပ်ရေးနဲ့ဆက်လင်းတဲ့အားပေါ့နောက်တစ်ခါမေလ10ရက်နေ့မှာ NCA Nationwide Ceasefire Agreement ထိုးထားတဲ့လက်နက်ကိုင်10ပွဲနဲ့နိုင်ငံတော်ကဆွေးနွေးခဲ့ပါတယ် COVID-19 နဲ့ပတ်သက်တဲ့ကိစ္စရပ်တွေထိန်းချုပ်ဖို့ကာကွယ်ဖို့သူတို့နယ်မြေတွေမှာလည်းကျွန်တော်တို့ပူးပေါင်းဆောင်ရွက်ဖို့ဒါအပြင်ကြံတဲ့လက်နက်ကိုင်10ဖွဲ့ကိုလည်းကျွန်တော်တို့ဒီကိစ္စနဲ့ပတ်သက်လို့လူသားချင်းစာနာတဲ့အနေနဲ့ဆောင်ရွက်ဖို့ဒါကမ်းလှမ်းပြီးတော့ပူးပေါင်းဆောင်ရွက်နေပါတယ်နောက် bilateral meeting တွေလည်းလုပ်နေပါတယ်ဒါဟာကျွန်တော်တို့ငြိမ်းချမ်းရေးလုပ်ငန်းစဉ်အတွက်အထောက်အကူပြုတဲ့လုပ်ငန်းတစ်ရပ်လည်းဖြစ်ပါတယ်ဒါအပြင်ကျွန်တော်တို့ဒီလက်နက်ကိုင် EAO နယ်မြေတွေရဲ့ non-government control area နယ်မြေတွေမှာလည်းနောက်ပိုင်းမှာ Myanmar Risk Education နဲ့ပတ်သက်လို့ COVID-19 ကစပြီးတော့ပူးပေါင်းထားတဲ့အနေနဲ့ဆက်လက်ပြီးတော့ဒါကောင်းသောခြေလှမ်းတစ်ရပ်ဖြစ်တယ်လို့ကျွန်တော်အနေနဲ့ဖြစ်ဆွဲပြီးတော့ပြောကြားလိုပါတယ်ဒါကြောင့်မို့လို့ဒီနယ်မြေတွေမှာ COVID နဲ့ပတ်သက်လို့ knowledge နည်းနေတာ access မရတာတွေကအခုတဖြည်းဖြည်းနဲ့ကျွန်တော်တို့ထောက်ပံ့မှုတွေနဲ့တောက်လျှောက်နိုင်ငံတကာအဖွဲ့အစည်းတွေထဲမှာအစိုးရစီစဉ်နေတဲ့အကြောင်းဖြစ်ဆွဲပြောကြားလိုပါတယ်ကျေးဇူးတင်ပါတယ်
Just to complement MAG's presentations on Myanmar, so it has been pointed out that the EAO, the non-government control areas, the Myanmar risk education and activities, and DG would like to complement that two things, what the government of Myanmar is implemented. So first thing is that on 27th of April, government formed a committee to coordinate with the EAO, ethnic organizations, with regard to the COVID-19 response. And on the 8th of May, so government conducted video conferences on the COVID-19 problems with the 10 EAOs who's already signed the nationwide ceasefires agreement. And also the REX 8 EAOs were also invited to coordinate with the government to respond to the COVID-19 pandemic activities. This also supports the peace process of the Myanmar, and it can be replicated even after the post COVID to promote the Myanmar risk education and EORE activities in the futures. So that is what Myanmar government is implementing with regard to that.
Okay, thank you. I see there is some technical matters, but yeah, I think we have to go back to the previous questions on how are we going to deal with a different risk from a different group of people. If I can invite Dr. Joe to respond on how to deal with this different group of people with a different level of risk.
How to deal with them in what ways? Sorry, I think I missed the question. Could you just repeat the question?
Right. So Bayu mentioned that some group, like for example, children, they're more risky with the explosive ordnance, whereby quite low risk in the COVID, and then the other group of people are in the reverse. So how to make sure that the risk education is delivered as needed and as relevant?
Well, I think I guess it goes back to thinking about who's the recipient of the education and what are their specific needs. So young children might not need so much information about COVID, but they still need to continue to have their risk education messages. But children do need some information, because otherwise they'll see people acting differently, and that will make them quite scared as well. But I think it's really about thinking what are the needs for different target groups.
Yeah.
But definitely encouraging children to, wash their hands, cough into their elbow and things like that, because otherwise they may contaminate spaces.
Yeah. Okay, well, I think we cover all questions. I know that there are more questions coming from the floor perhaps, but we have quite limited time, so please just drop your questions to the chat room, and we will address that question. So we will leave the meeting open until sometime if you have some more questions, and we will address those with the relevant person. So I think we come to the last part. I see Hal is back, but I think I will just continue to the wrap up and closing. Hal, if you don't mind.
Yes, please go ahead. I'm sorry I dropped out there.
Okay.
But I hope everyone stays healthy and safe, and I'll hand over to you, Dwi.
Thank you, Hal. Thank you. All right. So I think we've already heard from colleagues and friends. And again, thank you so much for participating and for your active intervention. Sorry that the time limits us. As it's already mentioned, many countries in ASEAN facing this imminent impact of COVID-19. So of course, the work has been put in pause, but still life must go on, I believe. As Sebastian mentioned, the threat COVID-19 will lessen, but the threat posed by landmines, explosive weapons, and so on remain in the world. So again, I think we all would need to be ready and adaptive in addressing the threat, especially during extraordinary circumstance sentence. So thank you again for all presentation. I'll make it as short as possible. We share already some articles on the risk education from MAC today, and the links to the library as well as the question and answer from the previous international EORE webinar. Feel free to access that, and later on we will get back to you with some key discussions. We will also provide the link to the presentation, so don't worry. We will ask for your inputs on the key discussion in a few days. So thank you again. I wish you a nice evening to those who reside in the region, and a nice day for whom joining from Mali, UK, Switzerland. Stay safe, well and healthy. Thank you so much, and see you at the upcoming webinar.